Hey everyone, welcome. It is Monday Motivation. Represent your country today in the comments, in the chat. Let me know what country you hail from. We had some nice intel about the ReMar audience and the top 4 countries that are currently represented for the ReMar audience, of course, is the United States of America. Second is the Philippines. We also have third coming in at Kenya. And then fourth is Canada. So I want to know today, what country are you representing? And then hopefully in the next week, I can give a report. And the week after that, and those countries will change frequently. But I'm so happy that you're here. How's your Monday going? This is, if it's your first time joining, this is what we call Monday Motivation across the nation. Hi, everyone. I'm Professor Regina Callion. I am the founder of ReMar Review. I'm also an author, a mentor, a daughter, a mother, all great things. But my passion is nursing and nursing education. So if you need motivation, encouragement, and also information to help you pass the NCLEX, you're in the right place. And not only do I teach for NCLEX, I love it. We are teaching out of Quick Facts for NCLEX today, but I also tonight am doing back to school for my nursing school students on today. So it's going to be very cool. We'll be working out of Quick Facts for Nursing School. And I will be going live right here, also on TikTok, as well on YouTube, on Facebook tonight. And back to school is all about just positioning yourself, not only with great information, but also the mentality, because nursing school is a temporary process that is supposed to lead you to the career of your dreams. The career of your dreams. Yes, it's difficult, but if it was easy, everybody would do it. So come to me tonight, back to school event. If you haven't signed up for it, you can go right to remarnurse.com/back to school, because it's happening. All right, so for today, we have to get right into it. We're going to be talking about benign prostatic hyperplasia, BPH. And as I'm gathering my things, we have to get into BPH, because if you have Quick Facts, which you should, we are going to see when we turn to page number 11. When you turn to page number 11, BPH, it starts at the bottom of page 11 in my book, but then it's this huge section that goes all the way to page 12 too. One of the largest sections in Quick Facts. So we mustn't dally. We have to hurry. So we're going to get right into it. And my goal for you today is to understand BPH, understand the signs and symptoms, the pre and post-operative clinical responsibilities. It's a lot. So are you ready? Put ready in the comments. Shout out to all of you who are passing NCLEX, because it is not easy. And I'm telling you, that license is so good. I'm trying to look for jobs now, make sure we have great jobs for you. We have a couple of nurses working. Texas is a major hotspot. Also, New York is great too. And then my international nurses making connections with companies that also are going to help us get you over here. I can't wait to welcome you. So let's get to page number 11. Thank you so much for all of your kind comments this morning. I love them. Okay, benign prostatic hyperplasia. Now, the reason why this is an NCLEX, we always like to ask, why is this an NCLEX? Oh, let me check really quickly. If you have, is this the nursing? I need to look. I just want to know, like, for my own personal self. Because we'll be working in this. Okay, so this topic is also in Quick Facts for Nursing School too, on page number 14. So if you have it, you can do both. We're going to be working in this book tonight, 8 p.m. Eastern time, setting along. So benign prostatic hyperplasia. So this is in Quick Facts for NCLEX and nursing school, because it is extremely common. It is extremely common in older men, and it causes progressive urinary obstruction. So we do need to know that. Now, let's look at just the name, because the name will tell us a lot about a condition. So we never want to neglect it. So we have the term benign here. If something is benign, we know that it is not what? If it's benign, then it must not be cancerous. It must not be cancerous, meaning these cells that are multiplying will not spread to other areas of the body. It will be just located at the second word that tells us this is the prostate. Now, if I asked you this question, would you know the answer to it? And I think this is my first question of the study session. The prostate gland, which system is that a part of? And we know that this is a condition where there's progressive urinary obstruction. What gland is the prostate? Which system is the prostate gland a part of? All right. So as you're thinking about it, I hope you can correlate it to the male reproductive system. It's the male reproductive system. And the prostate gland helps to support the sperm cell by making fluid, right? Now, we also have the term here. There's three terms: hyperplasia, hyperplasia. And so hyperplasia just means what? It means more cells. It means bigger, bigger, bigger. So that's what we have. And of course, for NCLEX, we need to know not only what these terms are, but the pre and the post-operative care. So the first question that I have in Quick Facts for NCLEX, and as you're reading this, all I'm going to do is just point you out to some of the key factors that you should see and take hold of as you're reading it. So the first question, very first question is, BPH is caused by? The answer, what is it? The cause is unknown. The cause is unknown, but it's an enlargement of the prostate gland. And so what happens is you have extra cell growth around the urethra. So let me show you. Let me get out my clipboard. And so this really shows kind of what happened here. So it's actually caused by cell growth in the part of the prostate that surrounds this middle structure, which is the urethra, where the male is going to void. And so as this prostate is getting bigger and bigger and bigger, it's squeezing the urethra. Okay, it's squeezing the urethra. So what I'm trying to convey to you in Quick Facts is, when this happens, what kind of symptoms do we think our patient's going to have as that prostate is getting larger and squeezing on that urethra, and also probably putting a little pressure on the bladder? So we're going to have this straining to urinate, a decreased urinary stream. Also, feeling like you have to go all the time, right? And then also at the same time, there can be a hesitancy when starting to urinate. And so all of these are important because we know that the older that a man gets, the more common this occurrence is. And so the next point is, men usually over the age of what? 50 get BPH. And it's really due to the hormonal changes that happen. So just as women, you know, as they age, they have hormonal changes, and menopause happens, and women, you know, they have different signs and symptoms. Well, this is something that happens in men. And so how are we going to assess this? The most direct way is a digital rectal exam. Now, the physician, I want to clarify this here. The physician does a digital rectal exam to rule out cancer. Okay. And so the reason that you want to rule out cancer is because this condition is supposed to be what? It's supposed to be non-cancerous. It's supposed to be benign. So when doing a digital rectal exam, what that physician is looking for is a pea-sized nodule, and that would indicate cancer. Okay, that would indicate cancer. So I'm not sure if it was so clear here, so I'm glad I'm going over this section. But the prostate in itself is a smooth structure. There shouldn't be any nodules there. Also, I have here to do a urine test. Now, what would be the purpose of doing a urine test for this patient? Why would this patient require a urine test? What do you say? What do you say? Well, the urine test is going to, yes, rule out infection, because if an older male has a urinary tract infection, can it cause dribbling? Can it cause hesitancy? Can it cause a fullness of bladder? It can cause some of the same symptoms. So you want to make sure that you are diagnosing this condition appropriately and accurately, because on the next page, we will see that the treatment is not just medications. Actually, if a patient gets diagnosed with BPH, they are going to get a what? A surgical procedure. So you want to make sure that you are right here. And so the common surgical, treatment is the TURP procedure. You have to know about this. It's non-negotiable. So I'm so glad that we're reading about it today. So the transurethral resection of the prostate. What does this mean? This actually means that we are going to cut away a part of that prostate gland. We're going to be removing, remember our picture here, when we talk about a TURP procedure, we're going to cut away some of this prostate gland. So my question to you as the nurse is, how is this done? Because remember, in Quick Facts, I say this is a surgical treatment. So if I'm a patient and I hear the nurse telling me I got to have surgery, the nurse better be able to explain what type of surgery I'm about to have. So a TURP procedure, the question is, how is it performed? TURP procedures don't take long. They take about an hour to do. Okay. But the question is, where is the incision in a TURP procedure? Where is the incision? And so this is one of the reasons why having the understanding of the most important topics will get you through NCLEX. You don't have to know everything. You don't have to study for hours and hours. Give me 20 minutes. Give me 20 minutes and you will be proficient in any subject. So the TURP procedure, there is no incision. No external incision is made. This is very important. A scope actually is going to go through the penis and it is going to remove a part or resect a part of the prostate gland from there. So this is very important. When you talk about this, I have a question. After the procedure, this is on page 12 now. After the procedure, what is the client at risk for? And the answer is bleeding. Monitor for hemorrhage. Hemorrhage is a big concern for this patient. Let me ask you this. Will the hemorrhage be internal or external hemorrhage? Will the hemorrhage be internal or external? Great critical thinking question. Gotta know it. Absolutely. The hemorrhaging is going to be internal. It's going to be internal. Yes, because remember, this is all taking place inside. So cutting away that prostate is going to cause bleeding where? Internally. All right. Very important point. We're talking about post-TURP procedure and post-op care now. And so now all clients will get a 3-way indwelling catheter. This is very important because the triple lumen catheter is used for 3 things. Not every catheter has 3 lumens in it. Some only have 2. Some have 1, single lumen catheters. And so what's important to note is that this catheter is triple lumen because it is going to have certain functions, right? Can anybody guess what the main function is for for post-TURP procedure. And I know I had a good image that I wanted to show you. I don't see it here where it should be, so I might have to bring it back. But anyways, the most important thing that the triple lumen catheter will do is going to be able to give our post-op patient continuous bladder irrigation. Okay, so 3 lumens. The first lumen will be, of course, to hold that catheter in place. So one like a balloon, you put air in it and it stays in place. The second lumen will be for urine to come out, because we're in a catheter situation. And so catheters usually are going to have that ability to drain urine. The third lumen is going to help with continuous bladder irrigation. So continually putting water into the bladder to irrigate it. All right, so that's what the 3 lumens do. And I have it there. 1 lumen inflating the balloon, inflow of the solution, and then outflow of the urine. That's continuous bladder irrigation. So this is going to be very important. The reason why continuous bladder irrigation is done is to help prevent blood clots in the post-operative client. Next point I want to make is what type of fluid is used to irrigate the bladder. This is a major point that you should know. The correct answer is going to be an isotonic sterile saline or solution. Isotonic is the best because it is not going to change the shape of the cells. Let me say it again. It's not going to change the shape. It's not going to swell or it's not going to shrink. It's isotonic, so it's an even exchange. If somebody asked you this, we have to use sterile solution, but is the bladder sterile? Is the bladder a sterile place like the heart, or is there bacteria there? Is it like the heart or is it like the mouth where there's bacteria? What do you say about the bladder? It's a good question. Is it sterile? Is it non-sterile? Oh, I love this. And I love working with nursing students. I love working with nurses. The bladder is sterile. Sterile. So we never want to introduce anything into sterile cavities such as bacteria. That's why when you are putting in your indwelling catheter, it's on a sterile field, right? And this is why so much pressure is put on us in nursing school to learn sterile technique. Because if you are careless, and I've seen it, and I know maybe you have too, in hospitals, in nursing homes, especially if you have a difficult patient, maybe the patient is morbidly obese or overweight, and you're trying to do sterile procedures, if your equipment rubs up against that person's skin or brushes up against the bed or anything like that, should you start over again? Even if that supply is $250 for that catheter set or whatever have you, if it touches a non-sterile surface, should you just be like, oh, okay, well, let me just put it in, or should you actually start all over again? Right? And so those are the things that make a nurse a great nurse. The integrity, when you know if something is right and you do it. Okay, so of course the bladder is sterile, the solution should be sterile. I want to move down to I guess during continuous bladder irrigation, what must the client be monitored for? So during bladder irrigation, we're looking for a bladder distension, fluid overload, hyponatremia, and water loss. And this is because sometimes when the body is exposed to so much solution, it will begin to absorb it much more than normal. Sodium levels can drop. The next point here are if bladder spasms occur, give blank and blank. I want to stop here because bladder irritation is something that can definitely happen because more than ever, the bladder will be getting so much attention that spasms can occur. And bladder spasms are very painful. If anybody has ever had a bladder spasm or a rectal spasm, oh my goodness, very painful for patients. Okay. And so they will need medication. They will ask for medication. It's not something that you take lightly. So what I have here are anticholinergics. Anticholinergic medications will relax the bladder. So I have here belladonna, which is the anticholinergic, and also oxybutynin. This is also an anticholinergic. But notice that the belladonna is mixed with opium. Opium is what? Opioid is a pain medication. So think about it in this way. You are given opioids in a suppository form, but you are still going to have to assess for opioid symptoms, which are respiratory depression. Okay, be very, very careful with that. That doesn't change. And then finally, I have the clinical priorities. I just want to make note that the best position for the BPH is going to be lying down flat. Remember, I know typically we like to sit patients up, but because the bladder is the part of the body that needs healing, it will be less irritated if the patient is lying flat. But if you put the patient in a semi-Fowler's position, that bladder is going to feel pressure. And remember, it's the blood vessels that we are trying to heal. So do they need rest? Absolutely. Okay. All right. Clinical priorities were there. Like I said, item, maintain urinary drainage is very important with BPH. So if you ever get a priority question, sometimes there's a priority question where the patient's not putting out urine. What should the nurse do? Is not automatically call the doctor. We need to check that indwelling catheter for kinks, for clots. Again, this is where the nurse is more important than the doctor. Your assessment skills at that patient's time of complication is going to take priority over just calling the doctor. This is one, just like we talked about with autonomic dysreflexia, your assessment at the bedside, way more important. And then, of course, preventing hemorrhaging. So that was a walkthrough through benign prostatic hyperplasia. And this is going to be a continuation of us just reading through quick facts, making sure we understand it. Blood administration is next up for Wednesday. Again, tonight I'll be coming back on for back to school special. I'll be going through nursing school. I'll be going through the nursing school quick facts tonight. I'm not sure what exactly, but I'll be going through that book. Also, for those of you who are testing in the month of August, it's our time. It's our time. If you're studying with V2, don't forget one of the only NCLEX reviews with money back guarantee. So pass NCLEX or get your money back. I'd love to tell you more about it. If you don't have the V2 program, please check out remarnurse.com for all of your questions about the V2 products. And then before we go, let me get into our motivation across the nation. And this is for all of those who struggle with anxiety, you struggle with insecurity, and you're on this journey to passing NCLEX, but you like to have your faith boosted along the way. Let me tell you about this idea for us this week. Peace begins when you pause. Peace begins when you pause. And I'm talking to the busy bee. I'm talking to the person right now that has a list of 10 things that you need to get done, and you need to get them done yesterday. I'm talking about the person that is taking care of themselves, their children, their husbands, their parents, their neighbors. You have your church, you have so much on your plate that you barely get a moment to yourself. I want to remind you, I want to ask this question though. When's the last time you've been on vacation? You can say never. When's the last time you had a good sleep? Mm-hmm. When's the last time you just laughed without worrying? Like you had a moment where there was no, oh, I got to pay this bill, or I got to really get this done, the insurance, doctors, the dentist. When's the last time it's been like that for you? That you just are like able to just relax? Or are you constantly on to the next thing up until bedtime? Even when you wake up, it's just like a quick, thank you, Lord, I'm up, and then hit the floor running. I want to challenge you this week to break out of this pattern because it's so unhealthy. And we think about, we think about causes of early death. And I don't even have the research. I'm just saying, just thinking about causes of early death. Isn't stress something that can shorten your life? And if you're constantly in a state of stress, how much you missed out on because you're just rushing to get to the next thing. Like you can't even enjoy dinner because you're already thinking about, okay, after dinner, I need to go back to studying, put the kids in bed, get my clothes out for tomorrow. Like, are you that person? Let me tell you this. Hebrews 4:10 and 11. Let's just read it together and then we'll talk about it. Hebrews 4:10 and 11. For anyone who enters God's rest also rests from their works, just as God did from his. Let us therefore make every effort to enter that rest, so that no one will perish by following their examples of disobedience. Oof. This is a lot here. What this is telling me when I read it is that instead of us having this mentality that we need to work, and then we earn rest, that we should start from a place of rest. Like we should wake up in the morning in that state of rest where it's like, God doesn't measure me by how much I'm getting done. He doesn't. God is not waiting for me to push myself to the limit every single day, and then I might earn some rest at the end of it. Man, we have this mentality that rest means I'm not doing anything. Like I'm not doing anything, but that's not even how God rests. That's not even how God rests. Rest means you're trusting in his work. Rest means that you are acknowledging him as your creator and your source of strength. The Bible says that the Lord made the heaven and earth in 6 days, right? And then he rested on the seventh day. He rested from his work. Now, if God is showing you his custom of taking a day off from rest, what are you doing working 7 days a week? Are you greater than God? You don't even give yourself 1 day of rest. You don't even take 1 day out and just say, I'm trusting God. I'm not doing any work. And that's one thing about me. I do keep the Sabbath, right? And so every Friday night to Saturday evening, I do no work. And it's been such a blessing to me because I actually love what I do. And some people love what they do. I mean, honestly, if I didn't have God telling me to just stop everything, I would just work. I would just constantly work. But me having this one period of time, it is such a great boundary for me to tell people I can't take the meeting. I can't be on the review, or nope, I'm not looking at bills. I'm not reading emails. I mean, even our staff, we don't have them work on Sabbath, because if all we have done for 6 days, on the 7th day, we're going to trust God to do whatever, because we're going to give that time back to him. So it's kind of like a tithe. Like if you tithe some time to God, that'd be the Sabbath day. right? And it's also in the commandments. And so I know there's this tension between, you know, what day do you keep? Do you keep Saturday? Do you keep Sunday holy? I'm not even getting into that right now. I'm saying that it is biblical for a day to be reserved. God did it. Jesus did it. And it allows us really to just acknowledge our creator. So even if you are, you know, even if you go to church on Sunday, if you go to church on Saturday, there's this mentality that God deserves a set period of time, right? And so every man must be convinced in his own mind, right? Every man must be convinced in his own mind what that time looks like. But it is supposed to be dedicated to God. And so all I'm saying for you today is that it is something that you should love yourself enough to do. And that is number one, start your day trusting that God is the author and finisher of this entire story. However many years you have on this earth, 40, 50, 60, 70, 80, 90, at the end of it, you want to be a part of God's bigger story. You want to be a part of it. And then also at the same time, that you have so many blessings along the way that if you're constantly exhausted, you're going to miss those blessings. When people say, my kids grew up like that right in front of me, we miss so much of that because we're just trying to get to the next thing. So don't miss out on the blessings of today. Don't miss out on the blessings of today. And I think that's my time. That's my time. So I would love to talk more about this. You know, I'll be going live tonight back to school. But of course, what I want you guys to remember is rest means release. It's letting go a bunch of the burdens that we are carrying. This is why rest is so important. Is letting go of the burdens, the fears, the what ifs that keep you up at night. Okay. And that's what rest allows you to do. It also means you don't have to try to carry the weight of fixing everything yourself. Sometimes when you slow down, God will reveal what's the best plan. But when we rush into something, have you ever rushed into something? Oh my goodness. I remember one time I rushed into signing a lease in an apartment that I had no business being in. Younger me. But you just rush into something without thinking. And then this right here, rest is not weakness. Choosing to let God carry the load is an act of faith, not a failure. A lot of times in the Bible, God revealed himself through dreams. People would have dreams about the future and what they are supposed to do. If you refuse to rest and go to sleep, God can't give you a dream. So rest, lay down somewhere, take a nap. Okay. I was doing a 30-day challenge. Good things are happening to me. I'm still finding great things happening to me every single day. And it's because I'm looking for them. So all in all, your Monday motivation has been served. Thank you so much for spending the day with me. Is how we are starting our week today. We're starting from a place of what? Not work, but rest. So enjoy the rest of this Monday. Go be a blessing to somebody. And as always, you know it, you can, you will, and you must pass NCLEX. See you later. Bye-bye.